We've heard a lot about this country's heroin epidemic, and for years, heroin dealers have been using another, far more powerful drug to cut the heroin they sell. But now federal officials are expressing alarm that people are using that stronger drug, fentanyl, alone, leading to overdoses and deaths. Blake McCoy went to Ohio to find out more.
He was the jokester. He was the life of the party.
Putra was just 19 years old when his parents walked into his room in Grand Forks, North Dakota, and found him lying face down on his bed.
When I turned him over, he was already stiff, and his eyes were open. It'll be something I'll never get out of my head.
Evan's parents knew their son had been abusing marijuana and pain pills, but it was something else that killed Evan in July of 2014.
I've never heard of the drug before until they told us what it was when the officers came.
This is fentanyl, an opiate up to 50 times more powerful than heroin, cheaper to make, more deadly, and now more in demand. It's become the focus of nationwide alerts from the CDC and DEA. Intended for a hospital setting to treat pain, fentanyl is increasingly being produced on the black market. And just this year, the CDC declared Ohio to be ground zero for fentanyl overdoses. The problem here in Cincinnati's Hamilton County is so bad, overdose deaths now outnumber car accident deaths and murders combined. Last year, the county reported 238 fentanyl-related deaths, a 153% increase from the year before. Newtown Ohio Police Chief Tom Sinan is leading a drug task force to combat the sudden rise.
Often the drug dealers are one step ahead, and we got to try to catch up a little bit.
His detectives are finding fentanyl laced in heroin and given to unsuspecting users. Once hooked, users are increasingly seeking out fentanyl on its own.
Here's the thing about drug dealers that's unfortunate. They're very good at knowing their customer, and they're very good at marketing.
In Chicago, a recent spike in fentanyl overdoses has prompted a public health warning.
It's a time bomb. It's totally dangerous, and patients really are playing with death if they're using it out of the hospital setting.
A fact Evan Putra's parents know all too well.
It is the very worst thing that a parent can ever go through. You're not supposed to bury your children.
Blake McCoy, NBC News.